This video will provide an outline of malaria, including its definition, causes, transmission, pathophysiology, clinical features, complications, and management. Malaria is a parasitic infectious disease caused by Plasmodium species. It is primarily transmitted to humans through the bite of an infected female Anopheles mosquito. Malaria is caused by protozoan parasites of the genus Plasmodium. The most common species are Plasmodium falciparum, which is the most severe, and Plasmodium vivax, which is the most common. The main route of transmission is through a mosquito bite. Rare routes include blood transmission via blood transfusion, organ transplant or shared needles, and congenital malaria from mother to baby. The pathophysiology in humans has two stages. The liver stage, or pre-erythrocytic stage, is when sporozoites infect liver cells. The blood stage, or erythrocytic stage, is when merozoites invade and multiply within red blood cells, causing them to rupture. The life cycle in the mosquito involves gametocytes developing into sporozoites, which then move to the mosquito's salivary glands, ready for injection into a human. The cycle in humans begins with a mosquito bite, injecting sporozoites. After the liver stage, merozoites released from the liver invade red blood cells. The rupture of these cells releases substances that trigger cytokine release, leading to fever with chills and sweating. Clinical features of malaria often include intermittent fever, chills, rigors, sweating, headache, body aches, fatigue, and nausea or vomiting. Malarial paroxysm is divided into three stages: the cold stage with intense shivering and rapidly rising temperature, the hot stage with intense heat, and the sweating stage with profuse perspiration and declining temperature. Physical signs of malaria can include pallor due to anemia, splenomegaly or an enlarged spleen, and sometimes jaundice. Complications can affect multiple systems. Central nervous system involvement can lead to cerebral malaria. Renal complications include black water fever and acute renal failure. Blood complications involve severe hemolytic anemia and disseminated intravascular coagulation. Other complications include metabolic issues like hypoglycemia and acidosis, gastrointestinal and liver problems such as jaundice and splenic rupture, and systemic issues like shock and hyperpyrexia. Diagnosis relies on the peripheral blood smear, which is the gold standard. A thick smear detects the parasite, while a thin smear identifies the species. Rapid diagnostic tests and a complete blood count showing anemia and low platelets can also be used. The next scenes will discuss the management of malaria.